having a cancer diagnosis, specifically a sarcoma cancer diagnosis, really disrupts people's lives and has some unique challenges. Sometimes the treatment is intense. At times, the patients require inpatient chemotherapy. They come into the hospital for their infusions for a week long, and that's a rigorous regimen. Sometimes patients are diagnosed at a young age. That also has its unique situation because we know that younger folks are typically thinking about dating, fun activities, their career, and having a cancer diagnosis really shifts that attention. It's really important for patients as they're going through treatment to speak up with their team members, their providers, about their concerns and needs. Talk to your oncologist to find out what services are available, what resources are available.
Nice to see you again. Yeah, nice to see you too.
An oncology social worker who works with cancer patients can really help with adjusting to having that cancer diagnosis in terms of making decisions about whether to keep working through treatment or not, how to talk to family members about your cancer diagnosis. Social workers can help with practical concerns like transportation, getting to the hospital for treatment, applying for disability or for the Family Medical Leave Act. If a patient could benefit from having a home health aide or medical equipment at home, the social workers are really instrumental in setting those services up for a patient. Treatment itself has costs. We have a financial navigator who can help address that issue for patients to reduce anxiety and provide support around that. Palliative care specialists can really address symptoms of the cancer, but they can also address side effects of treatment. Palliative care teams can also talk about advanced directives, a document that lets providers, family members know what a patient's preference is in terms of their care should they come to a point where they are not able to speak up for themselves. We want patients to keep eating through treatment, to keep up their strength, to be able to manage all that they're dealing with. And so the oncology dietitian is here to make some recommendations. We have an extensive rehab program at our cancer center, and those therapists are specialized in helping people regain their mobility, range of motion, and ability to use their limbs, particularly after surgery. We also offer many support programs that are available to patients and to caregivers. We get feedback from patients all the time about how valuable they are in terms of providing support, education, and just a chance to be with other people who are going through something similar.
We are going to start lying down on our backs.
The yoga classes are taught by teachers who have been trained to teach cancer patients. The focus is on balance, stretching, breathing. So it's a restorative yoga, but it's also really helpful with body image and getting back in touch with trusting your body again.
Namaste.
We also offer meditation and mindfulness. There's more and more data showing that meditation and mindfulness can be really helpful in managing the stress response and reducing inflammation.
So, welcome everybody.
We also have something called Reiki. Reiki is hand placements on various parts of the head and on the torso. They're just still placements, and they help instill calm, help participants to be settled and in their body and in the moment. Art therapy is really designed to give people an opportunity to use the creative process to explore feelings, ideas, and process what a patient has gone through in terms of treatment and in their recovery. We can direct you to reliable resources where you can get education about sarcoma that's available online. And then there are a number of community organizations that offer support groups and support programs that are available to patients and caregivers. The Sarcoma Alliance is an advocacy group that is a fantastic resource for information about sarcoma, as well as learning about opportunities to connect with other patients. Getting a cancer diagnosis can be challenging and scary for any patient. Because sarcoma is rare, sometimes patients will think they're very much alone. We want our patients to know that we're here to support them every step of the way, whether it's with your provider, your nurse practitioner or nurse, we're at social worker, we're all here to support you.